In my view, if a nation is to be judged by how it cares for the weakest, the most vulnerable people amongst us, the United States would not get particularly high marks. That's true with regard to how we deal with children, but today we're focusing on the needs of elderly people. And elderly people, by definition, are folks who have lived their whole lives. Many of them have worked their whole lives. Many of them have raised kids. Many of them don't have a lot of money, never had a lot of money. And they reach the end of their lives where they are no longer able to go out and earn a living, and they are plagued by what happens to people who get old with many, many illnesses and frailties and weaknesses. They are vulnerable. And I think both from a moral point of view, and we're going to touch on the other aspect from an economic point of view, we just cannot turn our backs on the millions and millions of seniors who are hurting in this country who need help today. And I know there's a bit of mythology out there pushed by folks who represent moneyed interests who seem to think that all seniors are doing just great. No, they're just great. They're all vacationing in Florida and so forth and so on. And they have not looked at the reality of what is of life for many, many seniors. And we have a panel today that is going to get into that to some degree. In America today, half of all seniors are unable to afford even basic living expenses or are living right on the edge. 4 million seniors live on less than $11,000 a year. Let me repeat that. 4 million seniors live on less than $11,000 a year. Frankly, I don't know how anybody lives on $11,000 a year. Even before the economic downturn, the number of seniors who are dealing with hunger more than doubled from 2001 to 2009. So when we talk about the recession, the economic downturn, too often we forget about the impact of that recession on seniors, but hunger has gone up. One of the most effective programs ever designed to address the needs of vulnerable seniors is the Older Americans Act. It was signed into law by President Lyndon Johnson in 1965, the same year as Medicare and Medicaid programs were signed. They, of course, are much better known than the Older Americans Act. The Older Americans Act provides federal funding for many essential services for seniors, including job training, caregiver support, transportation, health promotion, benefits enrollment, and protections from abuse. Significantly, more than 40% of the Older Americans Act funding is used to provide meals to millions of frail and isolated seniors through programs like Meals on Wheels and through congregate meal programs at senior centers. So when you talk about when you talk about the Older Americans Act, 40% of the funding is going to nutrition programs for seniors who need that help. Now, these meal programs not only work to ease isolation, and anybody who has any understanding of the Meals on Wheels program knows that its importance is not just the actual nutrition and the meals that isolated seniors get, but also the fact that somebody is knocking on their door to see how they are, to chat with them for a few minutes, which can mean an enormous amount to somebody who's living alone and who doesn't communicate much with the world. And one of the additional benefits of the Older Americans Act is that it brings huge numbers of volunteers from all over this country into the community to help seniors. But it is not just the help that seniors get directly through the meals program and the other programs that's important. When we invest in these programs, we save money. And sometimes some of my friends don't fully get that. But common sense and many, many studies tell us that if you are not providing nutrition to seniors, if seniors are malnourished, what happens to those seniors? It doesn't take a genius to figure it out. If you're malnourished, by definition, you're going to get sick more often than you should. If you're old and you're sick, where do you end up? You may end up in the emergency room at great expense to Medicaid or the healthcare system. If you're malnourished and you're weak and you fall and you break your hip, which happens, you end up in the hospital at an expense of tens and tens of thousands of dollars. The simple truth is that it makes a lot more sense to provide adequate nutrition to frail seniors than to spend money on preventable hospital costs. The simple truth is that we can feed a senior for an entire year for the cost of 1 day in a hospital. Feed a senior for an entire year for the cost of 1 day in a hospital, and we're cutting back on feeding seniors. Providing adequate nutrition reduces the need for nursing home care, for which the average cost is about $80,000 per year. Many, many seniors would much prefer to stay at home. We can do that. Saves the system money, keeps seniors in contact with their friends and their family, but to do that, we have to make sure that their basic needs are taken care of. Despite the success of the Older Americans Act in keeping seniors healthy, independent, and out of hospitals and nursing homes, its vitally important programs have been inadequately funded for years, even before sequestration, which cut $40 million from senior meals programs. Just think about that, what priorities we have as a nation when we are cutting $40 million from senior meals programs. Only a small portion, despite all of that, despite sequestration, only a small portion of the seniors who needed the services provided by the Older Americans Act were actually receiving them. And now sequestration means as many as 19 million fewer meals will be served. These cuts have resulted in wait lists from one end of the country to the other and have resulted in some programs simply closing their doors. Imagine that. Imagine that. In the year 2013 in the United States of America, our seniors should not be worried about where they will get their next meal. They should not be forced to decide whether they pay their utility bills or buy the prescription drugs they need. That is not rhetoric, that is reality, and I suspect every person sitting up here has met seniors who are experiencing that choice. Can't afford to pay for my electricity, can't afford my phone bill, can't afford my prescription drugs, can't afford to eat. What choice do I make? We should not be having that situation in America in 2013. The choice is ours. This committee will play an important role in that debate. Either we waste billions of dollars on emergency room visits and unnecessary hospital stays, or we provide older Americans the resources they need to live healthier, more secure, and more dignified lives. The good news is the Older Americans Act is an important part of the solution. The congressional authorization for the Older Americans Act expired in 2011. And while it has been extended with stopgap measures, it deserves not only to be fully reauthorized, but to be expanded in order to address the current crisis and the growing need. The Older Americans Act Reauthorization Bill S-1028, which I put forth with 17 co-sponsors, strengthens and modernizes the core programs of the Act, such as the Meals Program, and states that it is the sense of the Senate to do more than maintain the status quo, that funding for the Act should increase by at least 12% over fiscal year 2010 levels. The bill also updates the definition of greatest economic and social need, increases the focus of economic security in the Act, supports the modernization of senior centers, and strengthens the important provisions that protect seniors, especially the most vulnerable among us, including those living in nursing homes from abuse and exploitation. The Help Committee will be doing a markup on this legislation next month. This markup is long overdue. And in my opinion, I have not the slightest doubt that the vast majority of the American people support these programs. They want these programs expanded, and they want us to get our priorities right. So I want to thank again all of our panelists for being here, and let me give the mic over.